you towards the NABH digital standards implementation on finance and procurement management and human resource management and information management system. So this is the finance and procurement management. In this, in FPM, there are three standards which has been further bifurcated into 17 objective elements classified into the core, commitment, achievement, and excellence. The key intent of this chapter is to manage finance and purchase processes digitally, real-time capturing of supply chain, automation of the procurement cycle, and transparency to perform the patient billing functions. Digitizing the inventory system is essential for ensuring the right supplies and equipments when and where they are required, which will help to prevent stock out errors and improves clinical outcomes. Then the hospital user digital system to create and managing indents. This basically represents the automation of procurement processes. Means the digital indenting should be there, tracking status of orders. These all things will streamline the inventory management process, which will reduce excess inventory and saves time and effort. These both objective elements are self-explanatory. That means demand, purchase orders, their approvals, receipt notes, GRN, debit notes, credit notes, all will be done in a digital manner through a software, which will improve the efficiency and helps the management to track the process as well as to manage the budget in a more effective manner. The hospital uses a digital system to record any quality concern of the purchased hospital assets for maintaining the high standards of the quality by electronically documenting the quality concerns of the supplied equipments or the pharmaceutical products or any item. By tracking these issues, one can take appropriate corrective actions as well can trace the patterns over time, leading to recall of defective assets, reducing errors, and improve decision making. The first objective element in this is self-explanatory. That means that vendor payments to be ensured by any modes of digital payments. The second objective element says about that there should be an electronic database for all the financial transactions between all suppliers and clients. It will help to monitor financial performances, tracking the expenses, and identify the potential billing errors. So the hospital follows a periodic payment cycle. The hospital needs to automate the process of billing and payments, sending reminders for the payments which are to be done on a periodic interval basis, such as rent of any hospital premises to be done by the hospital. That is a periodic activity. Electricity bill to be paid. All those things can be automated. Then the hospital uses a digital system to create a debit or credit note. The second, this is self-explanatory itself, that automation of the procurement process, such as the debit note to any patient or the insurance companies and the credit notes for any overpayment or the incorrect billing to be ensured. The hospital uses a digital system for patients for pay for availing any hospital services. Same as a self-explanatory way, that any kind of payments to be ensured to be done by through digital payment methods for the services availing in the hospital. Then this is a core objective element. The hospital is a digital system that includes predefined charges. All the service charges and item charges are to be integrated in the HMIS in the form of templates. For example, the OP consultation charges, emergency charges, any kind of medical equipment usage, fees, any medicines, lab tests, all those things to be integrated in the HMS software. That will ensure transparency in the charges, accurate expenditures, and as well as the financial counseling can be done accurately. Then hospital digital platform portal for patient or family member, an online bill view portal can to be provided to the patients, so that they can sign up with their credentials and they can view their bills, and if any discrepancy is there, then they can appropriate inquiries can be done at the billing departments. And the second objective element indicates that proper notifications through the WhatsApps, SMS, emails can be automated if there is any sudden change or upgrade in the treatment plan, or if any consultant asks for any additional investigations. So proper communication to be done through the modes of digital platforms. Digital standardized billing templates. This is self-explanatory. Standardized pre-designed billing template is to be integrated for the billing purpose for HMIS for accurate billing for all those services. Just like if we say any kind of X-ray or imaging services patient is going to avail, then all the X-ray services, uh, all the bills or the prices to be integrated into the billing template. They should be predefined. Then this objective element states that all the process of insurance claims should be digitized. It will reduce the paperwork, it will reduce the errors, and it will reduce the errors as well if any missed bills will be there, and it will effectively manage the claims. Then this standard says that this objective element states that digital notifications of status of claims through mails and SMS, etc., it to be done. It keeps the patient or attendant updated if any over pocketing expenditure is required, which is not entertained under the claim. So that notification is to be communicate through any digital modes. HC, this is the HCE platform. HCX, it is basically the standardized communication protocol between payer and the provider. It acts like a gateway to enable the interoperability of health claims between payers and providers. In it is in accordance with the this HCX platform is accordance with the IRDA, Insurance Regulatory and Development Authorities guidelines. So next chapter is HRM. In this, there are 4 standards in human resource management chapter, which is further bifurcated into 14 objective elements. In this, no core objective element is present. So the main intent of this chapter is to efficiently manage the activities of HR department through a digital system or software. Activities including the activities such as the recruitment, trainings, attendance, payments, payrolls, appraisals, the offboarding of the staff, and the KPIs. All those routine activities of HR department is to be digitalized. So when we enter into the HR department of the hospital, there we find that we are surrounded by the staff files, their documents, etc. So most of therefore, by upgrading that to the digital standards, it will help hospitals to store, organize, and access employee information such as contact details, employment history, and all performance evaluations, training appraisals, certificates, all in an electronic format, so that it will be a one click away from the HR department, all the information. So all the staff information such as the personal files to be maintained digitally. Then all the professionals working in a hospital should be registered under HPR, Health Professional Registry, under the Ayushman Bharat Digital Mission. It will ensure that only qualified and trained professional healthcare professionals should practice medicine. And it will also provide clinical care and such as no quacks can practice. Then second objective element for this hospital uses a digital system to manage staff rostering. Now, for managing staff roster digitally, it will ensure the availability of right number of staff at the right time, ensure reduction of administrative workload, and improves the staff satisfaction and engagement. Then hospitals should use a digital system, preferably in the HR software or the HR information system for managing the employee attendance, leaves, pay slips, etc. A good HR information system or the software will include all these contents integrated in it. Means the onboarding process workflow of the staff, their job trainings, their time management or the duty rosters, performance management, appraisals, benefits, KPIs, HR KPIs, their offboarding informations. So all those things to be integrated into the HRIS, means HR information system. And online platforms allow hospital to advertise their job openings. These kinds of platforms to be integrated with HR information system to attract a larger pool of qualified candidates. And the second objective element, the hospital uses a digital system to track and manage internal employees referral. So digital system for internal referrals for referring employees between different departments, which help in identifying areas for the improvement of the staff. So the in this, the objective element is saying that employees should submit their resignation through a digital medium, which will automatically be triggered to the concerned departments, and the system will assist the staff for exit process, such as any kind of return of the equipment is there, removing access digitally from the system, and facilitates and ensures that system is being staff is being paid enough fairly uh, before their means offboarding processes. And similarly, the second objective element states that if a hospital is onboarding any new staff, then the necessary access should be given after necessary background information checks and after proper orientation training only. So automating the goal setting towards the hospital's missions, visions, and strategic objectives to it to track the staff performance, and accordingly performance reviews can be done. It will help the it will help the employee performance, engagement, and satisfaction. For this, one can also use the Google Forms into it for the real-time feedbacks, for performances, for trainings, for pre and post test, for analyzing the results, all kind of things. While onboarding also, a staff and facilitate should be facilitated. Induction training means the digital induction training should be gone on digitally. That can make it more efficient and in an effective manner. Then the new staff can be given access to online education material for conducting the induction training digitally. The new staff can be given access to the online education material. Online topic related pre and post test can be done. Analysis can be done accordingly. And there are various these tools are shown over above. Then hospital can use digital training means to train their staff. It will be efficient, then cost effective, and staff can complete the training at their own pace. It saves times and money and eliminates the travel expenses also. And hospital has a digital access to different medical journals. Hospital can have digital access given to firstly the hospital can have should have the digital access to various medical journals. Then these access should be given to the provided to the consultants or the staff to increase their knowledge and latest practices, latest innovations and practices happening all over the world. The second objective element is self-explanatory, that all the training records to be stored in a digital system. So the last chapter is information and management system. In the information management system, there are two standards, very short chapter, but having 18 objective elements. In this also, no core objective element is there. So the core intent of this chapter is that the hospital uses a digital system to manage the patient records, clinical clinical decisions support system to create customized care plans, and to provide the right information is available to right person at the right time. The main intent of this IMS is the same. Then interoperability, when the hospital uses a digital system that allows interoperate different defined data structures which are aligned to national and international guidelines. So there should be interoperability, means different systems can easily communicate and exchange the data seamlessly. These this technology to be used in healthcare systems. This is aided by FHIR, which is fast healthcare interoperability resources format, which is designed for a healthcare system on a strong focus on the patient privacy and security. So these are the technologies, and these are the languages which JSON and XML, which in that your EHR should be based on. The hospital uses digital system to define clinical standards. These system standards provide these standards, basically SNOMED, CT, and ICD codings. These are the shared language for the healthcare professionals in the fields of medical. So, thus this will reduce the miscommunications and errors, and it will improve the patient safety and clinical decision making. Lonic codes are similar, just like in the medical profession. There are SNOMED and CT. The clinical language is there. Similarly, for the lab results, there are the Lonic codes are there, which are means lab results are tagged with all these codes, which can be interpreted, and results can be exchanged and compared across different organizations as well different countries. For digital imaging, there are DICOM standards followed, which are followed national and internationally by imaging personnels. DICOM stands for digital imaging and communications in medicine. So, use of DICOM standards is essential in medical imaging, results in good accuracy, and quality wise it's also been improved as well. The exposure time of the imaging systems is also being reduced by taking up the DICOM standards. So the transformation of any kind of image using DICOM can be easily converted into JPEG and PDF format. These can be easily, just like I have shown in the previous slide, this image can be easily be transferred to this JPG image can easily be transferred to other concerned, means mobile laptops or the consultants or the patients party, anywhere that image can be transferred easily. So Any transformation of image using DICOM can be easily converted into JPG and JPEG and PDF format for easy sharing to a patient, and for the doctors for records and as well as for the interpretation. And if any voice related data is there, then that should be stored in the MP3 format, MP3 or OGG format, and video related any kind of data is to be safeguarded in MP4 or MOV format. These are basically general worldwide used formats for this audio and visual video things, sharing the video. Then the digital consents to be taken by the patients for use of patient health information to be exchanged by the other hospital and ensures privacy and confidentiality. That can be done through QR code, your barcode, or through the any kind of ABDM compliance solutions. The hospital uses a digital system for patients to request for data correction completion. So this is as per the compliance with the Digital Personal Protection Act 2023. Over here, the patients are directly involved in the correction and completion process. If we are means the hospital is empowering the patient for any kind of corrections to be done in their data. Then there should be some mandatory or defined uh, fields or the in the database that should not be missed. Means that should be marked with an asterisk mark, that can be that include name, address, phone number. Without these means important these data fields, that record cannot be saved. So the clinical and non-clinical templates to be defined in the HMIS clinical for use of the charting, for use of the patient doctors and the nursing staffs, such as the patient charting, admission, discharge forms, and progress notes. Non-clinical templates such for the use of HR or purchasing request or the administrative evaluations. So these both objective elements are self-explanatory, that the IT team will manage and maintains the hospital computer system, their hardwares, their networks, their software applications, all to be managed by the IT team. And hospitals should implement new technologies, as my senior Mr. Ramakrishnan sir had informed in the initial slides. Then second objective element says that for strengthening the IT structure, a team, a DPO means a data protection officer is to be appointed with in compliance with the Digital Personal Protection Act 2023. So the CDSS means the clinician decision support system to provide healthcare will assist CDSS will assist professionals in making clinical decisions, such as if any drug interaction or any double means duplicate drug has been done, duplicate dosing is being done, or the food drug interactions. Those all things can be avoided with the help of CDSS system. It will give an alert to the clinicians while prescribing or while injecting, giving the drugs to the patient. So use of digital dashboards for improving, it will help in improving the patient outcomes, performance, reduce the cost, increase the patient satisfaction, such as the time around indicators, all indicators related to the infection control. The hospital has a to strengthen the IT infrastructure allocation, to strengthen the IT infrastructure, allocation of budget should be there, such as earlier budget allocations were done on the infection control activities, your quality and patient safety improvement activities. So here also the budget allocations related to the IT sector, IT dependency should be done, such as on the software, on the system, on the hardware, keyboards. All those expenditures will come in the under the IT budget. So dashboard related to the analytical dashboards, it will help with informed decisions by providing the real-time insights into the patient care, such as what is the readmission rate, what is the bed occupancy rate, what is the length of the stay, patient satisfaction. So all those things you can one can manage through informative databases. So hospital HMIs is capable of interfacing with third-party systems. HMS interfacing with different platforms to be ensured to share the patient information across different platforms. This is essential for ensuring the patient receives right care at right time. Thank you.